morning and welcome to, I believe this is week 12 of the legislative session. We've seen a lot of each other, we've seen a lot of things take place, and this should certainly be an exciting week as more of the Medicaid debates and tax cut debates heat up this week. A lot of things happened on the Medicaid front last week with the private option, with the analysis that was put out by the actuaries for the Department of Human Services that showed that the private option actually is a more cost-effective option for the state than both simple fee-for-service Medicaid expansion like was initially proposed at the start of the legislative session, or the option to do nothing, which would automatically put several thousand people onto the health insurance exchange at the rates between 100 and 138% of the poverty level. The flip side of that, the private option or fee-for-service Medicaid expansion still costs considerably more to the federal government than no expansion does. I know that people are still working on numbers, and the margin between the difference in the cost to the federal government for the private option and the do-nothing option are getting closer, which probably makes the private option a little bit more palatable, but I think there's still a lot of serious discussion that has to take place. A lot of questions are still unanswered. The only information we've received back from the federal government was in a 2-page memo that wasn't necessarily even addressed to Arkansas, but it referenced several things in Arkansas. I noticed an article this morning by Ava Roy, who writes for Forbes, who has so far been pretty supportive of the private option in Arkansas. This article was quite a bit more critical about the details in the private option based on the memo that CMS sent out last week. I thought he asked some good questions that we need to ask and we need to answer. These are questions that I've had. And the first one is, will the exchange-based plans have flexibility with co-pays like private plans? Will they be able to incentivize good behavior? That's something that we've asked for. That's something that we've tried to put into the draft of the enabling legislation. We quite frankly don't have an answer on that, and I don't know when we'll be able to get an answer on that. But I believe that is critical to any kind of reform. Avik also asked, how will the new, and he calls them faux exchanges, plans pay? Will they truly be better for beneficiaries? Will these plans simply pay like Medicare pays? Will they pay like private health insurance pays? And we don't know the answer to that because we don't know what these plans are really going to look like yet. And the final question that he asked, he said, will the exchange plans really be any different than the current fee-for-service model and truly be able to reform wasteful spending, which that is huge. That's a critical component of anything that we do with the new private option, is that it has to incentivize good behavior and cut down on wasteful spending. These are questions that I'm not sure who can answer them. They're questions that we've asked, and I hope that somebody's working on the answer to these questions as well as others. If you look at the current trajectory, we've got a little over 2 weeks left here if we're going to get through by April 19th. That means that in those 2 weeks we've got to get enabling legislation drafted, we've got to get it through both chambers, and we've got to approve some kind of appropriation for any kind of Medicaid changes. For private option, even if we do nothing, we still have an appropriation that has to be taken care of. So there's a lot of work to be done, and there's still a lot of unanswered questions, and I'm still sticking to my guns that I'm not going to encourage our caucus to make a decision until we understand the true ramifications and impacts of that decision. If that requires us coming back to for a special session to do one issue, and that would be a supplemental appropriation for the federal spending on the pass-through for the private option, then I think that's prudent and wise to do that. I think there's another option that we could look at, and that would be to make the effective date in the enabling legislation July 1st of 2014 instead of January 1st of 2014. What that would do for us would be, if we approve this private option plan, which there are still a lot of questions about that, if we approve that, then that would give time for DHS and CMS to work out the details on it, to prove that they can meet the objections of the enabling legislation. If we didn't start it until July 1st, 2014, there wouldn't be any flow through of federal money on the plan until July 1st, 2014, which means we wouldn't have to include that in the appropriation in this session. We could do it in the fiscal session next year. I believe this would give us more time to get the plan established, to prove it, to vet it in the public eye, and to make sure that it's the right thing for Arkansas going forward. The next issue that we'll be talking about more this week are tax cuts. And I keep hearing that tax cuts are tied to Medicaid, and I keep saying that if tax cuts are tied to Medicaid, it's only because the legislature allows tax cuts to be tied to Medicaid. I know there was an article in the Democrat Gazette last week talking about how the governor had a plan to tie tax cuts to Medicaid, to say that the two issues were one and the same, but I still believe there are different issues that we can do tax cuts regardless of what we do on Medicaid, and I still believe that we need to keep those as two separate issues, and I think the legislature has the votes and the power and the authority to do that. With that, I'm going to open it up for questions.
So if the effective date for the enabling legislation where we said July 1st, 2014,
right?
Wouldn't that be after the mandate, the universal mandate for health insurance takes effect?
Well, the expansion under the, or not the expansion, but the exchanges would still go into effect January 1st, 2014, and you would still enroll that population there. But Medicaid expansion is up to the states, and we can do it at any time we want to, or we don't even have to do it. So I think allowing us to go to July 1st, 2014 gives us a lot more time to plan this. It's a totally new system. I know DHS is working hard, and they think that they can get everything in place and ready to go by January 1st, but I've got some concerns about being able to roll out this whole new plan by January 1st and it work like it should. And I think the last thing we need is to have a bad rollout on any kind of option.
How would that affect the population between 100 and 138% poverty? Would they be automatically put onto the exchange until the plan started?
I think we're in a good negotiating point. If we had the enabling legislation in place saying that we are working towards this plan with the private option, that we could allow all those enrollees to go on July 1st. I see what you're saying, that if we didn't have the plan in place January 1st, then would it automatically put those on the exchange? Well, at the end of the day, they would be on the exchange anyhow, but I think we can negotiate that to where the whole plan would start on July 1st, if needed.
But they wouldn't have subsidies to buy insurance with for the expansion into effect, so how would they get onto the insurance exchange?
Well, we would have to put that into the enabling legislation to say that the private option program would, the effective date would be July 1st, 2014. I know the first argument against that is, well, you're going to lose 6 months of the free money from the federal government for health care. But I would rather us develop a sound program that everybody can understand and support than just to make a rash decision here in 2 weeks and lose total control of what's going to happen on this private option.
So would the people up to 138% just be waiting for the first 6 months of the year to see if they're going to get subsidies to buy health insurance or not?
Well, I believe you would be going through the enrolling process to get them on to the plan. You just wouldn't have the plan in place until January 1st. And the reason July 1st. And the reason for that would be that the pass-through appropriation could be addressed in the fiscal session next year after we've had time to evaluate the work that DHS and CMS has done on this private option program.
So you would ask the Department of Insurance and Department of Human Services to create an enrollment process to enroll people for a program they might not get access to?
Well, there would be every intent to do the program if all the objectives of the enabling legislation could be met. But what I'm saying right now is if we approve the enabling legislation and we approve the appropriation in the next 2 weeks, then it's going to be totally out of the legislature's hands on what happens with this program. And on January 1st, they would try to start up some kind of a private option program if that's what we approve, with very little legislative oversight. Now, granted, we could come back in the fiscal session and not approve the appropriation for next year, but I'd rather have time to evaluate it and look thoroughly at the details and understand how the dynamics have changed between now and that point. Even if we approve it in the next couple of weeks, you've got a half of a year up until the end of this year until anything would happen on pass-through money anyhow. So it's a little bit of an issue with our fiscal session and the calendar year, but I think it serves Arkansas's interest better if we started this program on our fiscal year rather than on the calendar year.